will use this skill every single shift without fail. So we gotta get good at it. Hello everyone, it's Nurse Zara here and welcome back to the Clinical Skills series. In this channel, I make videos about nursing life, student nursing videos, and more recently, my Clinical Skills series. Now, what is the Clinical Skills series? These are a series of videos focusing on nursing clinical skills that you will commonly find out in practice or in placements. The most important aspect to these videos is the patient scenario section. They are designed so you can follow along and hopefully by the end of this video gain confidence in the skill. Today's clinical skill is nursing documentation, a highly requested video. You will use this skill every single shift without fail. So we gotta get good at it. Now without further ado, let's begin. What is nursing documentation? Nursing documentation is a formal record detailing the nursing care provided to an individual by a qualified nurse. It is our duty as nurses to keep our notes up to date, not only for the safety of our patient, but also to stay on the right side of the Nursing and Midwifery Code of Conduct. Your nursing notes are evidence of the care you have provided and can stand as a legal document in the event of a complaint or incident that takes place. We have this famous nursing proverb, which is, if it wasn't documented, it didn't happen. So I hope I have emphasized the importance of documentation so far. Now, naturally, working in the wards and documenting nursing notes is going to be different to if you were working as a general practice nurse out in primary care. So remember, always ensure that you are documenting correctly with your clinical area and according to your line of work. The type of nursing documentation we will be focusing on in this video is the ATE systematic assessment. ATE assessment is an acronym that stands for airways, breathing, circulation, disability, and exposure. Some clinical areas may have additional letters such as F for family and G for goals. When I was working in intensive care unit, we had ATE assessment and HUG. Going back to that point, it all depends on your clinical area. We're going to keep it simple. We're not going to complicate things too much, and we're just going to stick and focus to ATE assessment. Why? Because this is the standard assessment tool for all patients receiving care. Now let's set the scene and actually practice our documentation skills to a patient scenario. Let's meet our patient. You have been looking after 70-year-old Leah McDonald, a lady with a history of chronic obstructive pulmonary disease, also known as COPD, that she was diagnosed with 15 years ago. She is a heavy smoker and has been smoking since the age of 20 years old. The main symptoms she experiences on a daily basis include coughing and shortness of breath, particularly on exertion. She uses her inhalers as required and is pretty good at managing her own symptoms. Leah was admitted to hospital 2 days ago following increased shortness of breath and significant work of her accessory muscles while she was trying to improve her breathing. On admission to hospital, her saturation levels were 86% on room air. Leah clearly had an episode of acute respiratory distress and was admitted to hospital in the attempt to improve her oxygen levels above 90%. Day 2 of Leah's admission, you are the nurse that is looking after her on your long day shift, and you are now going to document the care that you have provided for her today. Here are Leah's vital signs. Now remember, we are going to be following the ATE assessment whilst we're documenting. So let's begin with a systematic approach. A for airways. Is the patient's airways patent? Can the patient speak in full sentences? When you are asking questions, are they able to respond clearly?
Airways patent, patient able to speak in full sentences.
B for breathing. This includes the oxygen levels, if the patient is being supported on any oxygen therapy, their respiratory rate, their work of breathing. Now remember, Leah has a past medical history of COPD. In patients with COPD, a normal oxygen level saturation range is between about 88 to 92%.
Patient's respiratory rate is 19 breaths per minute. Patient maintaining saturation levels at 88% on 28% of oxygen therapy via a Venturi mask. Mild shortness of breath upon movement, for example repositioning in bed, although remains stable. Nil use of accessory muscles, equal rise and fall of chest wall, productive cough present, sputum sample sent, nil stridor.
C for circulation. This is focusing on blood pressure, mean arterial pressure, heart rate and the fluid balance.
Heart rate 80 beats per minute, regular, strong rhythm. Blood pressure 130/80, maintaining own fluid balance, which means they're not on any fluid restrictions, drinking fluids regularly, good urine output, capillary refill time less than 2 seconds.
D for disability. This is where you're going to be using a lot of assessment tools, including GCS scoring, assessing the patient's level of consciousness using AFPU, pain scoring, and also checking their blood glucose levels, particularly if they are diabetic.
GCS score 15 out of 15 with a pupil size of 3 and reactive, hence the plus. Alert and orientated according to the AFPU scale. Pain scores 0. Blood glucose levels 5.6, which is stable. Mobilizing independently, eating and drinking, has a good appetite, and independent with all activities of daily living.
E for exposure. This is to do with the patient's skin, what you are exposed to. Checking pressure areas, wounds, evidence of rashes, any dressings that you need to check. This also includes invasive devices such as cannulas, drains, catheters, and also temperature.
Temperature 36.0. Pressure area sites are intact. Old scarring on legs noted, however no concerns raised as patient reported it's from pre-hospital admission and from a couple of years ago. No wound dressings, no drains. There's one peripheral cannula inserted on the right hand with a VIP score of 0. It's important to always put the date as well of when the cannula was inserted.
Remember the basics as well when you are documenting, irrespective of whether it's electronic or paper-based. You need to include the date, you need to include the time of when you are documenting, and please make sure that you have put your own name, including your job profession, at the end of your nursing note. Now, essentially that is it. And it is a lot, but with time, with practice, and of course, when you get familiar with the type of patients that you're looking after in your specialty, you will get quicker at documenting. Remember, the most important thing is making sure that your documentation is both clear, concise, and of course is informative. Now let's just cover some do's and don'ts of nursing documentation. So let's start off with the positives, with the do's. First thing is keep it systematic. Do not go away from the ATE assessment. The ATE assessment is a standard practice that we all learn whilst at university and is encouraged in the workplace. Perfectly fine to develop your own style of writing, like that will naturally happen. But remember, it's all about continuity of care as well. If you write your notes a certain way and then the next nurse who's coming writes it a little bit different and then the next nurse after that writes it differently, how are you keeping the continuity of care when it comes to your patient? So by having the same systematic assessment tool that we all can use, we're only going to ensure that we're providing the best care for our patient, and of course that important word of continuity. And like I've said before, when you keep it systematic, you are less likely to forget any important information regarding your patient's care. The second thing is document as you go. The NMC in fact states that we should be doing our documentation either at the time of assessment or as soon as possible. So this is a requirement that we have to do according to our professional body. Try to avoid leaving your nursing notes right to the end of the shift. At the end of the shift, your brain is going to be more tired. You're starting to unwind a bit. You're ready to go home. Therefore, get into a habit of writing as you go. That also ensures that you're giving accurate and up-to-date information as part of your nursing notes. Related to this point as well is writing on your handover sheet. Let's just say you can't get to a computer or something has just randomly come up, and you need to make a note of it. So get into a habit of just writing on your handover sheet, okay, at 12 o'clock my patient has gone to x-ray, okay, at 1 o'clock I got an update from the doctors regarding the patient's CT results. So by writing that down, and then when you do come to finally charting and sitting, got that all written there, and again, you're less likely to miss it as well. A big don't use abbreviations unless it's approved by your clinical area. I will give an example. The abbreviation for blood glucose monitoring is in fact CBG, which stands for capillary blood glucose levels. Now that's the official abbreviation, but what I have found is that one nurse might write BM for blood monitoring, or another nurse will write BSL for blood sugar levels, and even GL, which is glucose levels. Now they all mean the same thing to the minds of the person who's writing it, but why take the risk? What guarantee is that the next nurse or even the next member of the MDT who's reading your note is going to understand what you mean? So avoid abbreviations and try your best to keep your nursing language clear as possible. That is all. I really hope that you've enjoyed this video and learnt a lot. Be sure to give this video a like, leave some comments down below, and definitely subscribe to my channel and hit that bell icon so you can stay updated on all the videos that I post. And if you did enjoy this video and you enjoyed this series, then you'll enjoy the other videos that I've created as part of this series as well. So do check them out. I'll leave them in the description box below. Thank you so much, guys. Best of luck. Take care and stay safe. It takes time. It takes practice. Hopefully by the end of this video, you will get more confident in giving an SBAR handover. This is where you've got to be a bit assertive. There are tools like SBAR in place to help us as nurses when it comes to looking after our patients. Mrs. Jones is a 65-year-old lady